Kussmaul respiration is an abnormal breathing pattern characterized by an increased respiratory rate and depth of breathing with an irregular rhythm. We created this video to cover the medical definition and provide a brief overview of this topic. So, if you're ready, let's get into it. Breathing is a phenomenon that occurs automatically with no conscious awareness thanks to the autonomic nervous system. Structures within the brain send signals that control the rate and depth of breathing that occurs to meet the ventilatory needs of the body. Looking at the respiratory rate tells us how fast or slow a patient is breathing. Looking at the depth tells us how deep or shallow a patient is breathing. Ideally, every patient would have a normal breathing pattern with a normal rate, depth, and rhythm. Unfortunately, as you know, this isn't the case. As previously mentioned, Kussmaul breathing is an abnormal pattern of breathing that is characterized by deep and fast respirations. This pattern causes the patient to blow off a lot of carbon dioxide, which means that it is a form of hyperventilation. It resembles a deep and rapid breathing pattern as if the patient had just finished a strenuous exercise routine. Kussmaul breathing is often seen in patients with severe metabolic acidosis, diabetic ketoacidosis, and kidney failure in some cases. It often occurs due to compensation of metabolic acidosis, which is common in diabetics with diabetic ketoacidosis. In this case, the patient's blood gas would show a low partial pressure of carbon dioxide, low bicarbonate levels, and a severely negative base excess as well. That is because, as previously mentioned, the patient has increased ventilation, which means that they are blowing off too much carbon dioxide. Some examples of other abnormal breathing patterns include apneustic, paradoxical, Biot respirations, and cheyne-stokes breathing, each of which are patterns that we've discussed in other videos here on our channel. But again, for this video, we just wanted to provide you with a brief overview of this topic. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well because we have a ton of other videos on our channel that I think you will enjoy. Just a quick reminder, we are not doctors. This video is for educational and informational purposes only. And if you want to dive deeper and learn more about this topic, you can go to respiratorytherapyzone.com where we have a ton of free study guides, practice questions, and other helpful resources. I'll drop links to everything you need right below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.